Washington, D.C.
Joining us to discuss masks and the latest coronavirus spikes is Dr. Lipi Roy. She's a writer and physician with expertise on the coronavirus. Thank you very much for joining us. Now, do you think mask mandates or other temporary measures are the right approach at this stage in the pandemic?
So great to be with you, and thank you for asking these really important questions. I know the public is very concerned and confused and frustrated. Look, the CDC extended the face mask requirement for another 15 days or until May 3rd. And the reason for this, and I quote, they said, in order to assess the potential impact of the rise of cases has on severe disease, including hospitalizations and deaths, and the capacity for healthcare systems to accommodate, including the impact on people like me, doctors, as well as nurses and other healthcare professionals. And look, the response, this decision was in response to the increasing spread of the Omicron BA.2 subvariant, which now makes up 85% of U.S. cases in the U.S., which has gone up about 25% in the last 2 weeks nationally. So, the concern is, and there's been pushback, especially in light of the CDC's own metrics showing that 95% of U.S. is designated as having low community transmission. But when you talk to other infectious disease doctors and other experts, what they want to really convey is the fact that Omicron has been ridiculously contagious, and the BA.2 variant has been very virulent. And this idea that 95% of low community transmission, what's important to remember is that the positive antigen tests are not becoming positive until about 5 days after the onset of symptoms. And a lot of people now, with the availability of the rapid tests, many of them are not even reporting it. So I think there's a strong underreporting of cases. So that's why I think it's very reasonable to extend this mask mandate just for another 2 weeks, so the CDC and other health agencies can really get a better sense of what's going on.
In China now, for example, though, there's a tremendous wave of COVID across various cities, also just like the one that was in Hong Kong as well, and also South Korea. And this is a place that, had very high compliance with public masking. Are we overstating how much of an impact they actually have?
So it's interesting you should say that, because one of my colleagues who's an infectious disease doctor, her own son got COVID, isolated at home for 5 days, and then asymptomatic, wore a KN95 to school, and then still infected about 4 other students. So to me, it's not necessarily a failure of the mask, but rather it's a reflection of the degree of infectivity of this particular subvariant. Again, we as in the scientific medical community are learning every day about this coronavirus and all of the different variants and subvariants. So I think it's very reasonable for us to practice all possible mitigation measures, including masking, and not just surgical masks, but also N95, but it's masking, it's distancing, and if needed, isolation. I think we just need to practice every mitigation measure, at least for the time being.
Are there any other tools that are under-recognised on the list of things that health departments can or should do as rates tick up, do you think?
Well, the other thing we didn't mention is the V word, not just virus, but vaccines. So if you are not vaccinated, please make sure you get vaccinated, fully vaccinated, and boosted. We do know that the vaccines at least work. So the combination now of all the tools in the tool chest, right? The vaccines, masking, and distancing, all of these tried and true public health measures really do work. And then, of course, medications such as Paxlovid and other antiviral medications designed to work against coronavirus and this particular novel coronavirus. Those are all the things that we should be using, and particularly to protect those that are most vulnerable, the elderly, those that are immunocompromised and who have chronic conditions, all of which predispose to severe disease, hospitalization, and death.
Okay, Dr. Lipi Roy, thank you very much for that.
You're welcome.
Still ahead.